In today's health, we've got our health expert, Dr. Kevin Campbell here. We're talking asthma. Did you know it's the leading chronic illness among children and adolescents in the United States? I couldn't believe this. 1 in 10 children have this, and you know, it's a big cause for missing school. So we brought you in to talk a little bit about it. First of all, what is asthma for folks who've maybe never heard of it or don't know the actual causes and things of that nature?
So asthma is a disease that affects your airways that help you breathe and move air in and out of your lungs. It results in inflammation and swelling of the airway, lots of mucus production. And what that means is that your child may have trouble breathing, they may have an audible wheeze, they may get short of breath when running around, and it can be a potentially life-threatening illness.
So what are some, we were talking a little bit about genetic, or is it environmental factors that cause it? Because there's some debate about this.
Right. We think there is certainly a genetic predisposition, but there's also an environmental insult. Lots of these children have triggers, and triggers for asthma may include things like certain gases in the air, pollens in the air, molds, and that sort of thing. And it can be triggered by just a viral illness. Most children really present with asthma around age 5, but they can develop it at any time. Age 5 is really a real common age to develop asthma.
All right, so what are some of the symptoms?
One of the most important things to think about is if you hear your child wheezing, or if they complain of chest pain or shortness of breath while running around. If you notice that they're really sleepy during the day and have dark circles under their eyes, that's another sign and symptom. It's important to talk with your physician and get a good history and physical exam, and then they can do some special things called pulmonary function tests that can make that diagnosis for you.
So oftentimes you see the air pump and things of that nature. Once your son or daughter is diagnosed, what can you do to control it and treat asthma?
Really important, and you should also communicate this to your school nurse and your principal and teachers so that they understand. There's really 2 types of medications. There's preventative that you take every day that prevent asthma attacks, and then there's things that we call rescue inhalers, that if you start to have a wheezing attack and shortness of breath, you can use those very quickly to help relieve those symptoms. It's also important to have something called a peak flow meter, which is a machine that you breathe into, and it helps you understand if you're going to have a good day or a bad day or where your airways are that particular day. It's a good preventative way to deal with your asthma.
Right. Such great information there, especially when you consider 20% of children have it. So we appreciate that, as always. And if you have a question for our medical expert, all you have to do is email him. You can find all his information over at our website. Just hit up WNCN.com, head to the Today Show page under the New tab. So pretty great information there. Thanks, Doc. We always appreciate it.